Hello, my name is Dr. Drew Taft at Foot and Ankle Associates of Southern New Hampshire, and I wanted to spend a minute or two today discussing a new treatment that we are now offering in the office called Swift therapy, and this is for treatment of plantar warts. So quickly, a plantar wart is a virus that you pick up typically in areas of damp environments, so whether it's pools or gyms. That's generally where they hide out, and obviously you're more susceptible when you're barefoot in those areas, but it's a little virus that you pick up that then kind of develops onto the bottom of the foot, and people often mistake them for calluses, but they become more uncomfortable and can get larger in size, and then ultimately are diagnosed with having a plantar wart. And what makes plantar warts a little tricky is that they actually hide out in the skin. They don't go very deep, but being more superficial, they can actually hide from your body's immune system. So they can hang out and the body not recognize that they're there, which can allow a wart to hang out for weeks, months, or sometimes even years. So how does Swift work? So Swift works by utilizing microwave technology, these little microwaves that actually penetrate into the wart, and these microwaves create heat. And that heat is what stimulates your body's immune system to identify that there is something foreign on your foot, which triggers your body's now immune system to attack it and fight it and get rid of it. Your body doesn't recognize that it's there, so this is one way that we can now help the body identify that it is there, and that's what helps to now treat it and get rid of it. So microwaves are very safe. We use them in household appliances, as you know. They also are emitted from cell phones. There's no side effects because the microwave does not actually break the skin. There's no risk of infection. And again, they don't travel very deep. So because of that, there's no other destruction to any of the surrounding tissues. So it is a very, very safe treatment. And not only is it safe, but it is very effective. So we now have data going back 6, 7, 8 years that are showing that this Swift treatment is 85 to 90% effective on eradicating plantar warts. And this is a significant improvement over the efficacy from traditional methods, which rely more on destructive treatment options. So salicylic acid, laser therapy, cryo or freezing therapy, which destruct the skin and try to eliminate the wart through those methods, which do work, but don't have quite the same efficacy or predictability that we're now seeing with the Swift therapy. Now, the traditional therapies, obviously, one of the downsides is that they can cause quite a bit of discomfort. They can cause blistering, soreness for days. I've had people who have actually had to take 2 or 3 days off of work after treatments because depending on the size of the wart can become pretty uncomfortable. The beauty with the Swift is it does cause some pain at the time of the treatment. People often describe it as like a sting, but each treatments last only a second or 2, and that's the only time that you have the discomfort. When the treatments are over, you're not left with any pain, you don't leave limping. Most of the time after the first treatment, people actually start to feel much better, but there's no, the beauty is there's no pain afterwards. It doesn't leave you with any scars or blisters or sores that you have to care for. And we've had kids in the office as young as 6 and 7 years old who have tolerated the treatment very well. So most adults don't have any problems at all. And again, the beauty is that there's no treatments afterwards that are required. You don't have to put anything on it. You don't have to cover it with anything. You come back and see us in a month. Typically, you're getting 3 treatments. That's the average, sometimes 4. But typically 3 to 4 treatments, and that's enough to get rid of the wart. And so big question is this covered under insurance? It is not, because this is not a destructive procedure. Destructive procedures do have billing codes. Swift, because it's not destructive, does not have a billing code. So it is an out-of-pocket cost, but I will say that because of the less frequent times that you have to come in and have this done, and because of the fewer times that you have to have this done compared to traditional therapies, the cost is oftentimes less, or at least comparable to what your out-of-pocket costs may be when it comes to deductibles or co-pays for more traditional therapy. So we, again, are now offering this in the office. If you want to learn more, we do have some information on the website, so please check it out. You can certainly call the office as well, or come on in, and so if there's someone that you know or you yourself are dealing with one, come on in and let us take a look at it. Thanks again.